great to be together for what's our fourth annual member forum for IHPI. Actually, the very first one was on November 1st, 2012, which was actually my first day on the job. I hadn't yet moved to Ann Arbor, but that's when my appointment as director took effect. And it was really very inspiring at that first member forum to see how engaged all of you were. And it's been even more inspiring to see how everyone has remained engaged and helped us to grow as an institute and really build a greater sense of community and working together towards having more impact on improving healthcare and improving health. I also want to take this opportunity to thank our IHPI staff who've played a central role in organizing this forum. So a lot of what we do at IHPI really revolves around the talents of our staff, Jessica and all the others who have helped to make today possible. So as we think about the state of the Institute and where we are, where we've come, where we're going, I just want to remind you, and I think you've become quite familiar with our mission, which is to improve the quality, safety, equity, and affordability of healthcare. And as we talked about at last year's annual member forum, we focused on 4 priority themes shown across the bottom of the slide, and ways that we think capture the whole wide range of impact that our members are having in different areas, and areas where we can help to coalesce and to collaborate more effectively across our membership. So really thinking, how do we communicate what we're doing here at the University of Michigan and how it matters for the larger community? Also want to remind you that our purpose is really not just to get grants and write papers, but it's really to address big problems in healthcare and health, some of which are shown on this slide. And these span the age spectrum, the range of issues that we deal with, and are just a sample of some of the most important issues that we're all working on together. I'm also very pleased at this point at the state of the Institute is to report on the strong support that we're receiving from the leadership of the university, including President Mark Schlissel. In fact, when he had his annual leadership presentation 2 weeks ago to the university community, he actually cited IHPI as a special example of interdisciplinary collaboration working across schools on campus to address big problems for society. And I think we have a short clip of some of the remarks he made at that breakfast.
Our potential to be more than the sum of our many excellent parts is truly exciting. I'm looking for opportunities to bring university resources to bear on the biggest challenges and opportunities confronting modern society. The biggest problems we face as society don't conveniently set themselves up to be solved by one-source solutions. Problems don't know what discipline they're supposed to fall under. They're just problems. We can bring to bear the intellectual power of 19 outstanding schools and colleges to approach problems from every angle and from every perspective. We're doing this already in collaborations across the campus. Our Institute for Healthcare Policy and Innovation brings together a wide range of scholars from 17 of our schools and institutes.
So I appreciate that we have that support from our new president. We also have strong support from our new Executive Vice President for Medical Affairs, Dr. Marshall Runge, who joined us in March from the University of North Carolina. When we hosted our first meeting of the IHPI National Advisory Board in early September, Dr. Runge welcomed the members of the advisory board and was quoted in his opening remarks in talking about one of his greatest surprises when he arrived at the University of Michigan was discovering IHPI and our interdisciplinary approach to solving tough problems. And what he actually cited was that the health system could seek IHPI's input on what it needs to do to succeed, and that he welcomed the opportunity for our health system to be a testing ground for new ideas that we're producing here in IHPI. Another sign of the support that we have. Now, when we look back over the past 3 years since the first annual member forum in 2012, a lot of what we've been focused on has been building infrastructure. This was an institute that was new to the university. We really started from scratch in many ways. We had the interim leadership team led by Rod Hayward did a great job sort of setting up the structure for membership, thinking about how we would start to use the space and what some of the priorities would be. But as of September in 2013, when I arrived and Gail Campanella started as the managing director, we really had an opportunity to then translate that blueprint into a plan of action in terms of hiring staff and developing the plans for the programs that had been envisioned. So we feel like we've made a lot of progress, some of which I'll review for you today in terms of building that infrastructure. But now we're at a very important point in the Institute's development, roughly 3 years in terms of pivoting and starting to thinking, how do we use that infrastructure and apply it to solve bigger problems, to have more impact in terms of the work we're doing? And that's what we very much want your input for today. I also wanted to highlight the organizational structure that we've created. So working with me as director, we have our Institute leadership team, who Matt introduced earlier, and I'll show in a moment in terms of the specific members. We have our new National Advisory Board, which is advising us on how the work we do fits into the national and global context in terms of a university's role in improving healthcare and health policy. 3 members of our leadership team, Matt Davis, Brahmaji Nalamothu, and Eve Kerr, who you'll hear from at different parts of the afternoon in more depth, are playing important leadership roles within the Institute in terms of leading specific activities that are central to our mission. Gail leads a very able staff as our managing director. We've got a great communications team who you'll meet during today's presentations, our administrative and project staff who've been greeting you and are helping to organize today's event, and our Director of Government Relations, Eileen Kostanecki, who will also be speaking later this afternoon. And then we also rely on the university, the health system, and the medical school for a range of different support functions in different areas, such as development and finance and human resources that help us to carry out our mission. And then another thing that attracted me to the University of Michigan, coming from another place, Harvard, that has a great tradition in our field, is that there really was such a rich tradition of health services research and policy work here on campus. And we've, this fall, celebrated that rich tradition by assembling, under Lauren Hughes' leadership, the timeline that demonstrates the, Lauren Hutchins' leadership, the timeline of our work as a community, going back to the founding of health professional schools in the 19th century here on campus, and then following that evolution forward through the development of the university over the past 200 years. So I hope you'll join us at the reception after today's event, where we'll have an open house right in front of the timeline and in our new space across the hall. And you can see how some of our accomplishments over this 200-year period are presented both in the physical space we have here at IHPI as well as on our website. And it's not just the rich history that matters, but what was happening here on campus at the time IHPI was founded. And this slide shows 18 of our very vibrant centers and programs on campus, many of which were present before IHPI was founded, but I think have benefited from the opportunity to connect with other centers and programs through the Institute, as well as some new programs that are developing over time. And so it's really this combination of the talents of the individual members, the groups that were already formed here, and then what we can do as an institute, as a larger community coming together. I'd also like to highlight the collaborative quality initiatives supported by Blue Cross Blue Shield of Michigan. 17 of these CQIs are led by IHPI members, those listed here on this slide. And I'd particularly like to highlight 2 new collaboratives. One, the Emergency Department Improvement Collaborative, led by Keith Coker. The Pharmacist Transforming Care Collaborative, led by Haimi Cho. And then 3 changes in leadership where members of IHPI have taken over collaboratives that were existing and are leading them into their next phase. So Amir Ghaffari leading the Bariatric Surgery Collaborative, Lynn Henry leading the Breast Oncology Quality Initiative, and then Jennifer Griggs leading the Oncology Quality Consortium. So we have, I think, a great opportunity here for our members to be involved as leaders and participants in the important work of these collaboratives. We also highly value the work of our local partners, the 5 organizations shown on this slide, that collaborate with us and partner with us on specific programs and for which we're always looking for new opportunities to collaborate on important research or policy work. And Gail and I are continuing to meet with the directors of these local partners to understand their perspectives on how we as a university community can partner most effectively with them. So now I'd like to highlight what we've accomplished over the past year as a community and then use that as a foundation for thinking about how we move forward. So I mentioned our leadership team is an essential part of what we do as an institute. I'd particularly like to highlight two new members of the leadership team who joined us in early 2015, Karen Ferris from the College of Pharmacy and Caroline Richardson from Family Medicine. They joined a very lively group that helps to think about how we invest our resources, what programs and staffing opportunities we should be pursuing, and how we can work together across the schools. And so within our leadership team, we very much look for a broad representation of schools and departments among our members on campus. And then I mentioned our National Advisory Board, 10 members who we convened for the first meeting in September. They represent an important cross-section of leaders in state and national health policy and healthcare delivery, who we really benefited from their first meeting, and we'll share with you some of their insights and takeaway messages when we presented them a report on how IHPI has developed and where we might go in the future. And we'll move into that section of the program later this afternoon. In terms of our membership, we continue to grow. We're up to 465 faculty members across 17 schools and colleges on campus. The distribution of our members is shown in this slide. A large group from the medical school, but also significant groups from School of Public Health and the School of Nursing, as well as all the other schools and colleges on campus, representing about 13% of our membership. And I like to think of us as a coalition of the willing and the momentum that our growing membership can give us in terms of seizing new opportunities. So when IHPI was initially launched back in 2012, we started with 318 members across campus. And we've now grown that number by 50%, really by people stepping forward and expressing interest in being part of this community. And we continue to grow each year. And not that growth is an end in itself, but we see that as an opportunity to engage a wider cross-section of the campus community and then bring colleagues into new opportunities for collaboration. I just want to show one last very brief video clip that answers this question from the perspective of several of our members and really helps to communicate how we're working on issues like recruitment and bringing people together in new ways. And I think we'll be looking for your input in the next generation of how we communicate this message to our university leaders and our community moving forward.
IHPI is one of the reasons I came to the University of Michigan, and becoming a member was one of the first things I did when I arrived.
It's a way to bring people together from across the campus that I suspect would not have come together except for this organization.
Having us all together in this remarkable space, and also having the structured activities, the seminars, the talks, I think really creates a lot of opportunity for informal contact, for exciting chance encounters, and for really helping us innovate.
There's been some incredible resources that I've used pertaining to grantsmanship, manuscript preparation, access to senior mentorship in the specific area that I want to pursue.
Some of the tools and resources that IHPI has put out there on how to write a one-pager, how to talk with members of Congress, how to talk with members of the media about challenging scientific topics has been very valuable.
Each level of the research process, IHPI has things to offer. So when you're first thinking of a research idea, there's lots of different places where I go to sort of workshop ideas. And then once you've sort of figured out your question, how do you actually go about doing this? The IHPI has great resources to help you acquire data or sort of reuse other people's data. They also have great methodologists to sort of think about doing the analysis a little bit of a smarter way. And then once you sort of have your research findings, IHPI is also helpful in sort of disseminating that knowledge. Each step of the game, IHPI is there to sort of give your research more oomph, basically.
IHPI has made a huge difference in my ability to do my work, especially at the stage it was in. I was working in intervention research, but I was frustrated at the inability to translate that into policy change. So IHPI formed at a point that's very, very important for my vision of seeing this research turn into actual practice.
I never would have thought, even 10 years ago, that I would tell you I would be doing research with engineers. And I am, and it's terrific. And we're doing things that I never knew I would be able to work on, so it's really exciting.
We've recently received a $4 million grant from the Agency for Healthcare Research and Quality that is a partnership between the School of Engineering and the School of Medicine. I'm not sure I would have been able to get this grant if not for IHPI.
And when we compare what we have created as an institute relative to some of our leading peer institutions at places like the University of California, San Francisco, Dartmouth, or the University of Pennsylvania, we are substantially larger as a health services research community than those other peers. But we also have to think about what that opportunity provides for us, both in terms of what opportunity size can create in terms of the breadth and depth of work we can do, as well as some of the challenges in terms of keeping as many members as possible engaged and feeling connected and contributing to that work. We've been very successful in terms of funding over the past year. We continue to be. So over half of our members are principal investigators on externally funded awards, with over 500 grants active at the current time, over $620 million in funding, and about $123 million per year in spending in the most recent fiscal year. And we also continue to be very successful, even in a tight funding environment, in terms of working together to go after some large grants. So 22 of our new awards in the past year were for over $1 million. And then we also have been very successful through our VA Center for Clinical Management Research in successfully winning grants through the VA system. So 49 of our members have VA appointments through CCMR. 30 of them are PIs on over 50 grants. And that group has received $10 million in new awards in the past fiscal year and has nearly $50 million in active funding as of the past fiscal year. So as our membership grows, we're actually keeping pace in terms of new research funding, both new awards and active awards that our members are receiving. And when we look at where those awards are coming from, over 80% are from the federal government, from a wide range of agencies, the largest number, nearly 150 grants from NIH, but a range of other federal agencies. About 16% of our funding comes from nonprofit organizations such as foundations, and then relatively smaller slices, 1% each, from industry and from state and local government. So as we look for more balanced portfolios of funding to support our work, I think both the industry slice and the state and local government funding slice are opportunities for us to grow and have that diverse portfolio while we wait what happens with federal research funding. I particularly want to call out and congratulate our members, nearly 10% of our membership, who currently have career development awards, 28 from the NIH and 8 from the VA, and 4 of our members, shown here, who've received new awards in the past year. And I think this is really a credit both to the recipients of those awards as well as the mentoring teams that they've assembled to help them succeed in their work, and the recognition from our peers at other universities that the work they're proposing is important and deserving of support. In terms of publications, we remain a very robust and productive group, nearly 2,000 articles published in the past calendar year by about 3/4 of our members, and about 10% of those articles have appeared in the highest impact journals in our field. So those with impact factors of 10 or higher are shown on the left-hand part of this slide. And I think that really demonstrates that our work carries a lot of weight in the field, and I think as we think about communicating our results, we should constantly be thinking about aiming for the highest impact journals that will draw the most attention and recognition for our work. One way we can do that, and I think each of the last couple of years I've given a plug for this, is for all of you to be thinking of potential ideas for perspective articles in the New England Journal of Medicine or viewpoints in JAMA. We've been pretty consistent over the past 3 years, publishing about a dozen of these articles, about half in JAMA and half in the New England Journal. And those can be some of our most impactful articles where we take sort of the evidence and insights that we have as investigators and translate them into addressing important policy topics. And I want to give special recognition to Nick Bagley, who published an article in the New England Journal Perspective section last December on the King versus Burwell Supreme Court decision and what might be expected from that. As I tweeted at the time, that was the most widely viewed article of the week when that article was published last December, and it turned out to actually be the most widely viewed article in the whole New England Journal of Medicine over the year, with over 400,000 views. So where's Nick? I saw him here earlier. So good work, Nick. And I encourage others of you to think about topics and certainly seek me out if you have ideas for perspectives or viewpoints that you think might be good topics to pursue. So enough about publications. I wanted to switch to talk a little bit about our space. As we often say, we're both a physical and virtual institute. We started with about 77,000 square feet of space when this institute opened 3 years ago. We now have, just this past fall, added 10,000 square feet of newly renovated space. So we have plenty of space available for collaboration, including for our members who are based outside across campus at locations other than IHPI. So we encourage you to spend more time here as well. We also look to bring IHPI programs across campus as well. About a third of our members, 137, have their primary offices here at the North Campus Research Complex in our IHPI space. And we represent together about 2/3 of all University of Michigan faculty on this new North Campus Research Complex. So I mentioned the 10,000 square feet of newly developed space. This used to be the Pfizer Data Center, which was pretty much in mothballs for several years when the university acquired this space. And last year, we went through a planning process with the university facilities team and made a proposal to renovate this space, and we turned it into what we now call the Incubator. This was a planning effort that was led by Justin Dimmick and our space planning team within the Institute, and it's really turned out to be great space where we have a number of postdoctoral fellows, including our clinical scholars, as well as faculty working together in some very attractive space that's well suited to collaboration. And that's where we'll be hosting our reception after the forum this afternoon. Also want to remind you about our think tank, which is a living room-like environment just down the hall in Building 10. That's a place where you can go as an individual or in small groups to discuss projects or think or write. It's a very relaxing space to spend time, particularly for colleagues coming from elsewhere on campus, maybe in between meetings or before or after a meeting if you're looking for a good space to work. And then for larger meetings, we have our Collaboratory, which sits right outside the Injury Center in Building 10. This is a place where you can bring teams together as well as host outside visitors, such as here, an event where we hosted Congressman Tom Price, who's a graduate of the University of Michigan Medical School and now serves in the House of Representatives from Georgia. I want to give special recognition for colleagues who have led our research seminar series. So during the past academic year, that was led by Chris Fries from the School of Nursing and supported by some of our most talented clinical scholars. And we've continued that tradition in this academic year with Caroline Richardson leading the planning of our seminar series, also supported by clinical scholars within the Institute. And so we're always looking for ideas for speakers and topics that you think would be important for us to pursue, including our annual Director's Lecture, which we had the inaugural Director's Lecture with Wandi Brundebrun visiting from the UK, speaking several months ago. We have new member orientations led by Jessica Patterson, our new member engagement specialist. This is a way to rapidly bring new members into the community and help them understand the services and programs that we offer. Over 50 new members have attended those just since January. We're co-sponsoring a wide range of events with other groups on campus, such as the Ford School, the Center for the History of Medicine, the CHART, Center for Healthcare Research and Transformation, and the Injury Center, as well as supporting groups like CHEPS, the Center for Healthcare Engineering and Patient Safety, with their annual symposium here at IHPI. And then one area where I'm particularly pleased to see more activity developing is in terms of grassroots efforts by small and sometimes growing groups of members coming together to identify a need and then taking on responsibility with support from IHPI to meet that need. So we have a new medical specialist research seminar where work in progress is presented regularly. As we heard, there's a mixed methods workshop. A whole team of IHPI members in collaboration with the Department of Family Medicine are planning for tomorrow and Saturday here, a full 2-day symposium on mixed methods. We have a new K Award workshops coming together in collaboration with MISHAR, where we bring IHPI members who have career development proposals related to health services research to share their ideas and with coaches help to develop their work. And then a new transitions in care work group that grew out of one of our new member orientation seminars, where we're bringing together colleagues from pediatric and adult medicine to think about transitions as children and adolescents with chronic illness transition to adult care. So I want to close this part of the program by just highlighting what we see as a sort of an opportunity to pivot from building a lot of the infrastructure that I've just reviewed for you, and you'll hear more about in some of the next presentations, to thinking more about the signature initiatives. And this was an area where our National Advisory Board especially pushed us to think in more depth and really think about the frontiers of health services research and health policy and how we could push those frontiers in new ways. So when we talk about signature initiatives, we have certain criteria on our leadership team that we're starting to think about, that it should address a large healthcare problem, that it should have the potential for regional or national impact, that it be an opportunity to connect faculty members across IHPI schools and colleges, that it fit well with our expertise and capacity, that it represent timely opportunities that we can respond to, and areas where IHPI can make a difference, where resources that we either have or can create can really help to leverage an opportunity to have a major impact in a new area. So we have a few examples of signature initiatives that are either underway or in the planning stage. So two that are well underway include our Healthy Michigan Plan evaluation, where we're partnering with the State Department of Health and Human Services. With approval from CMS, we have approximately 20 faculty members from 5 schools and colleges on campus collaborating on this 5-year evaluation that we're doing in partnership with the state. IHPI has also picked up the baton on the Clinician Scholars Program. What used to be the Robert Wood Johnson Clinical Scholars Program will be wrapping up in the summer of 2017, and the University of Michigan through IHPI, along with the 3 other sites for this program, Yale, University of Pennsylvania, and UCLA, have come together to sustain that program, with each of the universities stepping up to support their local fellowship and then collaborate across the 4 sites, along with collaborate with the VA, and potentially over time introduce new sites and innovate, for example, by bringing nurse scholars, postdoctoral scholars from nursing, into an interprofessional training program with our clinical scholars from a medical background. So, okay, thank you, Stephen. And then we have 2 other signature initiatives that are in the planning stage in development, one led by Michelle Heisler, which is in collaboration with our Detroit Urban Research Center based at the School of Public Health and involving faculty from across campus. And this is trying to find a more sustainable model for supporting and engaging community health workers in the city of Detroit and working with Medicaid health plans that serve the city of Detroit to ensure that people's needs are met in their neighborhoods more effectively. And then we have, in the planning stage, Michigan Center on Value Enhancement, or MCOVE, led by Eve Kerr, where we're trying to develop new ways of partnering with our own health system to address important problems in healthcare and promoting greater value. And so that really fits the spirit of the comments that I quoted from Dr. Runge, our Executive Vice President for Medical Affairs, in terms of how we can partner more effectively.
It's my privilege now to talk about the education and training initiatives supported here at IHPI. And if we go to the next slide, I want to highlight for you in the next few minutes the unique faculty training opportunities that IHPI has had an opportunity to provide, the multidisciplinary educational innovations that I'll be sharing with you, and the fact that a consistent message I hope you'll hear in my remarks here is that we are all about promoting interdisciplinary collaborations when it comes to our education and training efforts here at IHPI. If you have a chance to go to the timeline, you'll see that from the very beginning of health services research efforts here at Michigan, the emphasis has been on educating the next generation. And that, after all, is one of the gifts and the legacy of U of M, is the number of individuals who've been trained and the great rigor with which they've been trained. And it's a privilege to be part of that teaching and learning community here at Michigan. From that collaboration, we really have the training and education mandates that we have here at Michigan, not only to support the existing efforts, but also to provide additional value. It's a pleasure for me to work with the Education and Training Work Group shown here, and our charge is to identify the existing educational programs and training opportunities here on campus, and especially synthesize them into experiential learning opportunities. Those experiential learning opportunities are really the training grounds for the future of health services and health policy research. We look throughout the educational pipeline, starting at the undergraduate level and extending through graduate level doctoral training and postdoctoral training to try to make sure that we are giving learners at every stage the opportunity to engage with IHPI, learn from faculty, and figure out what their next training opportunity might be, either in our environment or at other institutions as well. The Clinician Scholars Program is a great example of that, where we have individuals who have been at Michigan for several stages of their training, and also individuals who've been brought in from other institutions. John mentioned that we're having a transition here. We're part of a 4-institution transition from a program long supported by the Robert Wood Johnson Foundation, which will now be supported through the generosity of several different departments here at our university. The Clinician Scholars Program will welcome its first cohort. Rod and Michelle Heisler and I just welcomed 6 individuals who will be forming our first cohort starting in July 2016. And our final cohort of the Robert Wood Johnson supported program just entered this past July in 2015. As part of the Clinician Scholars Program, we'll also continue our quite successful master's program in health and healthcare research, which has provided additional learners, oftentimes at the fellowship level, but also some junior faculty from many different disciplines with the opportunities to learn health services and health policy research. We're also proud of our collaboration with the Center for Healthcare Research and Transformation, CHART, on the Health Policy Fellows Program. You can see some of the most recent fellows in that program, where they have an opportunity over the course of several months to interact with not only each other coming from different schools, but also with members of state legislative and even federal legislative staff. And together with those policy learners and clinician learners in the same classroom, we're able to have a very lively conversation and learning environment when it comes to applied health policy. The fellows have just been named for the 2016 cohort of the CHART Fellows Program, and we want to congratulate them here in terms of their selection, and we look forward to their participation in this exciting program. Another feature provided here at IHPI for learners at a different stage is the IHPI R01 Bootcamp. We are deeply grateful for the excellent mentorship of Mark Ilgen and Sarah Hawley, pictured here on the left of your slide, and the mentees on the right of your slide have benefited from their mentorship as they've sought independent project funding. You can see here the variety of the disciplinary backgrounds of our mentees, and that's one of the hallmarks of IHPI, not just in terms of the membership, but also in terms of these training opportunities. The IHPI R01 Bootcamp has been such an exciting success that we've also then thought about how we can continue that in the future. And we've managed to recruit both Mark and Sarah to continue their high quality work. And we have currently 9 mentee applicants from the schools that you see here. Again, tapping the tremendous disciplinary diversity of the IHPI community. We're very pleased also, in part of the grassroots efforts that John alluded to have the chance to support a unique 2-institution initiative between IHPI and our cousin institute across Huron Parkway, MICHR, the Michigan Institute for Clinical and Health Research. MICHR, many of you know, has provided a career development or K-writing workshop for several years. And what we're doing in this next season of K applications is providing specific mentorship from our faculty environment here at IHPI to make sure that our K-writing applicants have the appropriate topical and subject matter expertise that's going to support their applications. That program has launched just this month and is designed to have 3 sessions over 5 weeks and get our applicants prepared for the late winter and early summer application cycles. Here are some of the K-Writing Workshop mentees who are signed up to be part of this next cycle, and we wish them well as part of this novel venture with IHPI and MICHR. Let me close with some remarks about training the next generation, that is to say, individuals who haven't yet completed their clinical training or completed their doctoral studies, but are still in the process of sorting out what sort of opportunities are going to help them decide about the pursuits they want to continue in the future. Many of you are aware that the medical school is in the process of a major curricular reform effort, and part of that reform involves the development of what are called paths of excellence. All paths should be excellent, right? So this is no different. These are paths of excellence designed to be affinity groupings for students who want to pursue advanced study around a particular topic. These topics are agnostic as to the clinical discipline. So in other words, whether a medical student wants to be a surgeon, a psychiatrist, or a pediatrician, they can get together if they want to speak about or learn about health policy. I have the pleasure of leading this path of excellence around health policy with Amir Ghaffari and Jeff Kulgren, who I also saw here, Jeff, and with Beth Tarini, who is busy training the next generation. She's out on maternity leave right now. And the four of us together have been delighted to help get this path of excellence started with 26 of our now second-year medical students, and we're about to open the application cycle for the next path of excellence cohort. This is one of now 6 paths of excellence in the medical school curriculum. I'll skip the residential MOOC and finish that at the end of this slide, but I wanted to highlight a couple of other opportunities. One is a residential course on healthcare policy and politics based in Washington, D.C. This course was designed by Tom Buckmuller and Amy Cohn and has been a fantastic way for almost 36 students to be involved in an intensive series of seminars in the District of Columbia and have the opportunity to interact with policymakers and their staffs in that intensive political and policy-related ambiance there. We've also had, just this past summer, the first effort to put together for summer research programs and student-faculty lunches, which have given medical students and doctoral students who are here over the summer a chance to interact with IHPI faculty in a less formal environment to learn about their career development and talk about topical issues in health policy today in the U.S. and around the globe. Over 70 or about 70 students took advantage of this lunch and learn opportunity this summer here on our campus. And finally, the residential MOOC, or massive online open course that we've called Understanding and Improving the U.S. Healthcare System, has been an effort to get into the virtual learning environment and do so in a special maize and blue way. Many of you are familiar with the MOOC opportunity, which offers learners an asynchronous way to learn about a topic in a virtual environment. And with my colleague Michael Rubion at the School of Public Health, we developed a 6-week course as an entry-level course to understanding the U.S. healthcare system that we delivered in an online international environment now a couple of years ago. Based on the success of that original course, which involved over 3,800 students around the world, we were then asked by the provost to develop a residential form of that MOOC here on campus for all learners at U of M, no matter what their school, no matter what their level of training, whether undergraduate, graduate, doctoral, et cetera. That first run of that course, which was required for all first-year medical students and all first- and second-year dental students as part of their curricula, involved over 800 students from the Ann Arbor campus, Dearborn campus, and Flint campus, which is thought to have been the first course ever offered at Michigan that was offered across all 3 campuses simultaneously. In closing, I wanted to share with you some of the sounds and sights from our MOOC in this brief trailer, and I will be contacting many of you in the next few weeks to invite you to be IHPI facilitators for our small group discussions in the next run of our residential MOOC, which is coming up this January and February. With so much news around the Affordable Care Act right now, it's easy to forget that the federal government did not always have such a big role in our U.S. healthcare system.
I now urge that its coverage be extended without further delay to provide health insurance for the elderly.
We are going to fight for medical care for the aged as long as we have breath in our body until it's passed.
I am proposing today a new national health strategy. It emphasizes keeping people well.
I do envision the day when we may use the private health insurance system to offer more middle-income families high-quality health services at prices they can afford.
Every other advanced country with which we are competing for the future has figured out how to give all their people health care security. I say, give it to the people.
We're going to continue this conversation in week 5 in small group discussions all around the University of Michigan campus. These small group discussions, made up of students from all across schools and colleges and facilitated by faculty members from our Institute for Healthcare Policy and Innovation, are going to be a way for you to start understanding your role in this healthcare system and how to be an informed participant and lead to positive change. Hopefully that gives you a little flavor of one of the innovations that we have here in education and training through IHPI. And I'm now going to turn the podium over to Eve Kerr, another member of the Institute leadership team and the director of the Impact Accelerator here at IHPI. Eve.
Good afternoon, everyone. It's really a pleasure to be here. I have the distinct honor of being able to recognize some of our members for the impact they're making for their research. And this is our second annual Impact Accelerator Awards, our 2015 Impact Accelerator Awards. And let me just tell you a little bit about the genesis of the awards. And got it. All right. So, when we started the Impact Accelerator a couple of years ago, the motivation for it was really to think about how we can help propel our members' important work to have higher visibility in the public light and have higher impact on policy. And by policy, I'm really thinking of a kind of very global, all-inclusive policy. It could be policy at the individual practice level, it could be policy at the local or state level, or indeed at the national level. And so we thought about a lot of different ways and resources we could have, and John talked about some of those resources this morning, and particularly developing our government relations program and our communications program, I think has helped tremendously. But we also developed the Impact Accelerator Awards, which is a venue for recognizing some of our members who have had that kind of high visibility role in working both junior faculty as well as mid and senior level faculty, really instilling in their work a way and a path to have impact on policy and practice. So we do have, as I said, two kinds of awards. We have awards for early faculty members as well as mid-career and senior faculty awards. Our criteria that we use for selection is use of high-quality research, that, of course, is what we do here at IHPI, engagement with policymakers. So we like to see that engagement kind of at every step of the research. And then we ask for an endorsement from the end user, so somebody who has felt that they have benefited from the research and has really can tell us how it's affected the policy or practice on their end of things. Our winners do receive $1,000 in their faculty accounts and also have a research brief that's written about their work, which gets disseminated widely. So I want to first, before I go on to the awards, thank our committee members who were, for the selection, who were Gary Freed, Jeff Kulgren, Amy Bonnard, who was one of the recipients last year of this award, Helen Levy, Peter Jacobson, and Marianne Udow-Phillips, who was the co-chair with me of the selection committee. So thank you very much to those committee members. So without further ado, because I know you guys are like, who got it this year, right? So our first award is for someone who needs no introduction because he's already been on this podium several times today. And that is to Matt Davis. And so, Matt has actually had a very significant impact in policy in many different ways. And through the Children's Hospital National Poll on Children's Health, he's actually done a lot of survey work that has impacted policy, but we needed to kind of focus on one area where he has had specific and recent impact on policy, and that has been on his contributions over the last several years to the design and actually implementation of the Healthy Michigan Plan. And so, back after the Supreme Court decision that made the Affordable Care Act possible, Governor Snyder in Michigan was wondering, should we expand Medicaid here in the state? And one of the concerns was actually that there wouldn't be sufficient primary care capacity, that primary care providers wouldn't be able to see the patients. And so Matt designed, in partnership with CHART, a survey of Michigan primary care physicians and actually demonstrated that 81% of primary care physicians anticipated expanding their practices to newly insured patients. And what was really remarkable is that not just the survey, but he did the survey. He did it very fast. He got the results to policymakers, again, in partnership with CHART, very, very quickly. And those results were used actually in the arguments that Governor Snyder made to expand and establish Healthy Michigan here in Michigan, which I think was remarkable. But Matt didn't stop there. He actually said, okay, well, now I've influenced policy. Now I actually want to be a policy maker. And so he joined the state of Michigan as the chief medical executive from 2013 to 2015. And I actually want to share with you a quote from James Haveman, who was then the director of the Michigan Department of Community Health. And he said, Dr. Davis joining the state of Michigan team for 2 years was of great benefit to us and to the 10 million citizens of our great state. He was a portal to knowledge, research, and additional pivotal resources. As part of our team, he helped design the basic platform of the Healthy Michigan Plan. He influenced its design, write-up, its content, its implementation, and its research evaluation methodology. Many of the features that have gained national attention came from Matt Davis. His brilliance in policy, finance, research, design, and evaluation has made it possible that over 600,000 adults now have health care in Michigan. Congratulations, Matt.
Eve, that was very kind and entirely undeserved. All of this is a team effort, whether it's in Lansing or here at Michigan. The team gets said a lot here because somebody famous said it one time. But that's one of the things I have really, truly treasured about being here as part of the U of M family. What you said is factually accurate in terms of the role that I had a chance to play as a part of a partnership with CHART to get the primary care physician survey done. What you said is factually accurate in terms of being part of the team to develop the Healthy Michigan Plan. But I have to say that one of the most proud moments I had is after that was finished, I have supported several of our clinical scholars and other fellows to assess what's going on with the Healthy Michigan Plan and what's going on in the primary care environment, and to have their work through their efforts, and I'm gesturing at Rainer Tipernini in particular, actually help us understand that what we anticipated in Michigan has actually come true. And for those of us who can help anticipate the future with our work, that's exciting, but what's even more exciting is when it actually comes true. And that is a tremendous opportunity. I don't know if I'll ever have it again in my career, but it's been a true privilege to be a part of this family and to be part of the policymaking environment in Michigan during this critical moment that, as I say to the medical students, do not take for granted what time you're living in right now. The moment where you can add 600,000 people to the insured group in 9 months is truly extraordinary, and we cannot let any of our students and trainees take that for granted. Thanks very much.
Now, I think it's really fun to see the work of our junior members, our junior faculty also, and the impact that they're having at such an early stage of their career. It's really very impressive and humbling. So the next award that I'd like to present is for Julia Adler-Milstein and her work on the health insurance exchange. So Julia is an assistant professor in the School of Information and the School of Public Health. And she has worked extensively on transforming electronic health records into better care. And specifically, she's been looking at why, in particular, the health information technology adoption has been maybe not as fast as we'd like it to be. Although I understand you just published a paper that maybe it's faster than we thought, but I haven't read it yet, so I can't comment on that. I just saw it on Twitter. But in any case, her work has also shown that, while a lot of other research has focused on kind of organizational structures and the problems with the technology itself, she's also revealed that misaligned financial incentives for health information exchange lie, at least in part, on the slow progress that we're facing. So she has worked extensively with the Office of the National Coordinator for Health IT at the Department of Health and Human Services, and as well as requests by Congress and informational briefings. She's been led projects for the ONC. She has recently been asked to join a task force for clinical, technical, organizational, and financial barriers to interoperability. She has testified in front of the Senate committee in February of 2015 that was also focused on the spread of health information exchanges. And she, of course, has published quite widely her research in high-impact journals and in particular in health affairs. I think she's had more papers in health affairs than we can, probably anybody here in the last probably 2 years. So she, as I said, she testified in front of Congress, and so the quote I'd like to read about the impact of her work is actually from Lamar Alexander, who's a United States Senator from Tennessee. And he said in a letter to Julia, "Thank you for testifying at the Senate Committee on Health, Education, Labor, and Pensions hearing on March 17, 2015 regarding the state of electronic health records in our healthcare system. You were an integral part of driving the conversation on this important and complicated issue. Not only were you able to keep the discussion flowing, but you were able to articulate the complexities at an approachable level, and you generated a lot of interest from the committee members in the process. I hope you will continue to work with my staff toward my goal of getting specific recommendations from stakeholders like you." Congratulations, Julie.
Thank you so much. I'm so honored to be receiving this award, and just want to echo Matt's comment that it really is a team effort, and I just can't imagine being part of a better team than being here at U of M, and just am particularly grateful to my collaborators and my terrific doctoral students who are really the ones that make coming to work every day fun. And I just maybe, as a comment on the policy engagement, I mean, over the past year, it's really the first time that I've been directly engaged with policymakers and just have really enjoyed the process in a way that I didn't expect. I mean, I think you're lucky when there's policy interest in the research you do, and so I've been the beneficiary of that interest, but also helping policymakers understand a very complex topic. IT and technical infrastructure are not sexy, not fun to think about or talk about, and sort of figuring out how do you engage policymakers and helping them understand the key issues and not get bogged down in the complexity has really been a fun challenge, and something that I hope, when I'm at Matt's stage, I can say that we've succeeded. We are not quite there yet, still really working on interoperability and trying to get information to follow us across care delivery settings, but I think we're making progress, and I think the engagement with policymakers is probably the first step to some real progress. So thank you.
And because, we actually had tremendous applications at all levels, but the committee had a really particularly hard time with the junior faculty applications because they were of such high quality, and also because we recognize that junior people are only junior for a short period of time, so if we don't get them now, we might not get them later because they're not going to be junior anymore. So we really felt we had to give 2 awards in the junior category, and the second award goes to IHPI member Nicholas Bagley, and you guys, I probably don't even need to say anything more because John already showed how many reads he got of that New England Journal paper, but let me just say a few words. So Nicholas is an assistant professor of law at the law school, and he's receiving the Impact Accelerator Award for his analysis and commentary that impacted the ruling of the King versus Burwell Supreme Court case. And he has, as you have seen, written extensively, both in the kind of medical journals that we read, like New England Journal of Medicine, most read article in this last year, but also for media outlets like the New York Times, the Washington Post, the Wall Street Journal, and online sources like the Incidental Economist. So he writes really in a very approachable way about topics that are not necessarily normally approachable. And his writings about, 4 critical words in the case established by the state were widely cited, widely read, widely discussed. And, whether we can trace direct or indirect by evidence, we clearly feel that those writings influenced the Supreme Court's decision. And so the quote for Nicholas's work comes actually from Chris Priest, who's the Deputy Director of Strategy in the Executive Office of Governor Rick Snyder, who said, "I regularly rely on Professor Bagley as an expert resource in my position as Deputy Director of Strategy in the Executive Office of the Governor of Rick Snyder. His research into how the healthcare market is regulated, how the courts interpret the Affordable Care Act, and his writings on various topics have helped me to advise the governor on how to strategically shape health policies for the state of Michigan. It is my belief that Nick's work will continue to help improve the health of Michiganders and all Americans." Congratulations, Nicholas.
Thank you.
A few words?
Sure. So it's not often that a lawyer is welcomed into a room full of doctors. And so I just wanted to say thank you and to extend my warm sense that I really am welcome. And that I have become part of the family in a way that I wouldn't have expected when I joined the faculty 5 years ago. The Affordable Care Act has been an enormous gift, not only to the people who've gotten insurance, but also to the lawyers who now have more work. And it's been a gift to me because I can offer thoughts that sometimes people care a little bit about. So thank you for your support. I certainly would not have written the articles that we've talked about today had it not been for John saying, "Hey, should you want to think about publishing in the New England Journal?" And I said, "Oh, I have an idea." And then 3 weeks later it was up. So without that kind of nudging, I wouldn't have done any of this. So thank you.
Thank you to all the winners, as well as great applications. And we welcome these applications. We'll be having another round for the 2016 IHPI Impact Awards that will come out in the late spring. And so we welcome applications and look forward to reading about your great work next year.